Hi, welcome to Sum of Your Parts podcast. I'm your host, Dr. Betsy Greenleaf, premier pelvic health expert and women's wellness warrior. Join me as we discuss women's wellness topics and discuss tips and tricks with top elite health experts, and where you'll discover that you're greater than the sum of your parts. With October being Breast Cancer Awareness Month, what better way than to discuss prevention of breast cancer with Dr. Lourie. Dr. Lourie is a dedicated practitioner with over 3 decades of clinical experience as a naturopath, acupuncturist, homeopath, and functional medicine expert. She understands the complexity of chronic disease and applies the integrative tools of nutrition, targeted supplementation, lifestyle changes, and positive mindset to help women recover their health. A core concept of Carol's comprehensive approach towards health is that a mind-body perspective of disease is vital to true healing to occur. She takes a holistic approach towards illness, looking at what is the message of a person's disease, including the emotional, mental, and spiritual aspects of illness. Everyone's healing journey is unique to them, and what is important to a person is their beliefs and that healing is always possible. I'd like to welcome with us today, Dr. Lourie. Thank you, Carol, for joining me today.
I'm so happy to be here with you.
So I was looking, you have so much training in your background. You naturopath, you got homeopathy, you got acupuncture, you have, and the list goes on. How did you get to where you are today?
Well, I love talking about this because it's an interesting story. I was in my 20s and I had finished my undergraduate degree in psychology, and I had thought about going to medical school. And the universe brought me I was living in a communal spiritual group in upstate New York. And one of my roommates had cancer. Wow. And I accompanied her to Colombia, where she was told by the doctor, there's nothing more we can do for you. Basically, go home and die. And she was a young woman, and she thought, that's not going to be my reality. And she found this. In this, you have to understand, this was in 1976, where the word detox was not a common household phrase. Nobody heard of detox.
Yeah.
And this was a chiropractor who did detoxifying regimes, protocols using iridology. And for those of you who don't know what iridology is, it is a science. You take your iris and it's mapped out into very specific areas that match your body. So if there's little black spots or little yellow spots or lines, that's an indication that you have some metabolic processes or imbalances going on in those areas of your body. That's what his diagnostic tool was. He looked in your eye and asked you questions and felt around, and then you were given blended salads and juicing and nuts and a whole way of eating. And she did this, and she started detoxing, and she was spitting up the stuff coming out of her lungs because she had a tumor in her lungs.
Wow.
And there were these black specks that were coming out in her mucus, and she had it analyzed, and it was part of the metals from her chemotherapy.
Wow.
So that was, And then I started working in this doctor's office as his assistant. And this is how naive I was. It's very funny when I tell the story. This young woman came in, she had very bad cystic acne. And I remember thinking to myself, okay, why is she here? You have acne, you go on antibiotics. What's the big deal? I mean, that is how naive I was. It's very funny when I think about it. And a month later, she came back and her skin was like 30% better. She had lost weight. She felt better. And within the next month, she was like 80% better. And he was getting all of the rejects, quote unquote, that the medical system either had messed up or hadn't been able to help. And so I got a firsthand exposure, an introduction to the beauty and the power of natural healing. And one day I was going through this huge pile of paperwork, which we all have in our offices. We just tend to stick stuff to the side and think, oh, I'll get to it later, and we don't get to it. So here was his pile, and that was my job. And there was the catalog to the National College of Naturopathic Medicine. And I said, oh, I found my path.
Yes.
And there I was. So that I applied and I got in, and that was the beginning of me becoming credentialed in a way that would allow me to do the type of healing work that over 30 years later, it's hard to believe, here I am.
That's absolutely amazing. And It's interesting because I think nowadays people know more about naturopaths, but I remember when I went to medical school, I only knew about MDs and that was it. And
Not
lo and
even
behold,
DOs? You didn't even know about osteopaths and those things?
no, I
Oh,
actually I ended up in osteopathic medicine by accident, in that when I applied to medical school, you had to do this first round application.
right.
And then they said, okay, well, we'll accept your application. Now send us $50 more to do the real application. And I just got tired of sending money to places. So New Jersey was the one state, which I'm a resident of, which was convenient, where I could pay $50 and I covered my application to 3 of their schools.
Mm-hmm.
And I said, well, what is osteopathic medicine? And when I found out that there was this whole body approach, I was like, oh, wait, that sounds more like what I want to do. But even now that I'm out, when I came along and found out about naturopathic physicians, I was like, man, that's what I really should have done. That was really what fit me more. But I was like, at this point, I'm not going back to school.
No, but that's what the Institute of Functional Medicine provides professionals. I mean, you can either go to their seminars or do it online and learn so much of that wonderful information that we use in our practice.
So what do you do mostly in your practice?
Well, I specialize in working with complex chronic disease. So people come to see me, and the majority of my practice is women. I see men, but it's mostly for women. But people come to see me when they have done the medical route or they've seen other natural doctors and they're still sick.
Yes.
And I think that is a complex problem. And I like to work with the complexities. And my skill set as a homeopath really, and I have a background in psychology, so I really combine what is the underlying cause of why you are sick and what are the messages that your illness are giving you. So whether it's fertility, older women who have had multiple miscarriages and failed IVFs, and the doctor says, I don't know why you're not getting pregnant. Everything should be working, and it's even with IVF, it's not. So sometimes there's an inflammatory condition, and sometimes the woman just needs to be built up in a way that standard fertility work doesn't quite have the ability to do. So I'm like the other end of the continuum. People who have chronic anxiety and depression are on medication but still don't feel well. Homeopathy is wonderful for that. And lately I've been getting into specializing really in women, supporting women with integrative tools for breast cancer. And I came to that because about 14 years ago, one of my dear friends had breast cancer and was diagnosed. And I went to every single appointment and surgery and infusion and radiation. It took 18 months for her to be completed with her treatment. And that exposed me to an up close and personal look of what was working with the medical oncology world and really what was lacking after treatment to help a woman recover and reduce the side effects from these intense drug treatments.
What kind of things did you find along the way with this?
Well, I found that, and my friend was treated at UCSF. When you go to UCSF, and I don't know about other oncology centers, it's a 5 or 6 hour day. So you need to bring food, you need to bring your water, and you need to stay hydrated, and you need to be prepared for the fact that it does take 5 or 6 hours. The infusion center where she worked, there were a lot of burned out nurses.
Yeah.
And that was unfortunate because she had good veins, but one time a nurse, blew out a vein and there was just no reason for that to happen. And so you have to really engage with the nurses to make sure that they're seeing you as a person and not just one of 8 people that they're responsible for doing the infusions. And you need to go into your infusion with the right mindset. And I took all of this information and I condensed it not only into my clinical practice, but I've created an online program for women. And we have women all over the world using this. Because if you think that you're going to, let's say you want to run a marathon or climb a mountain or go skiing or whatever, you don't expect yourself to just know how to do it. You have to prepare. And I think going through cancer treatment is similar to a triathlon or a marathon. There's that diagnostic phase, and then we go through the actual active, what I call active treatment. And then we need to recover after our active treatment has been completed. And then we move on to a very critical phase, which a lot of people do not talk about. But I asked in my online community, what is the number one concern you've had since your diagnosis? And 80% of the women said that it will come back.
Yes.
And it does come back. And so I have module 3 in my online program is called Preventing Recurrence. So we want to make the body inhospitable to tumor growth. And we do that through attending to the microenvironment. And there are very specific tools that we can use. Now, this is in addition to medical oncology care. This is not a substitute. I've had women say, you're giving me false hope because you're telling me this is going to definitely prevent recurrence. And there's just no way that I'm saying that. I'm saying that it's my job to show you how you can use tools so that you know that you have the peace of mind that you're doing everything possible using the best of both worlds, medical oncology and integrative care, to have the best possible outcome for yourself. And that's all that we can all do.
I think that's a good point because our health system is definitely broken. We all know that, the traditional Western medicine system. And I just recently came out of working for a hospital system where I was being told to see more patients and spend less time. And that's not the way things need to be done. And like you said, there's nurses, they're everybody's trying to cut back. So they have one nurse has 10 bazillion patients that they're being responsible for. And now those people become less of a person and now they're a number. So you got these burnt out nurses that are treating people like numbers and one more thing that they have to do. And you have a newly diagnosed cancer patient that, you get that some patients are not even getting called into the office to get the diagnosis. They're getting a phone call and be like, hey, by the way, you have cancer. Have a good day. Click. So, to be in that space, I knock on wood, God forbid, I, have not had anything like that happen as of yet. And I hope to keep it that way. But I can't imagine being that person and finding that information. And I'm sure psychologically for a great number of us, the mind probably goes straight from, oh my God, this is a death sentence, when it doesn't have to be that way.
Right. And I think that when women come into my practice and they've been newly diagnosed, first of all, I'm really happy that they came to me so early because there is a lot that you can do to reduce the side effects of chemotherapy while protecting the healthy cells. And the wonderful thing is that all these protocols that I have are science-based. There's no touchy-feely, well, let's just all drink green juice and we're going to be fine. They're based in science and there's references for everything. But empowerment and education and really a common-centered mindset goes a long way in dealing not just with breast cancer, but any serious, complex, chronic disease. And I really believe that when you use these tools, you put yourself out of the box of standard oncology care as far as what are your side effects going to be, how are you going to get through chemotherapy and radiation, and then how are you going to recover your health to move on to really have a long life. And there's no guarantees, but we all want to tip the odds in your favor.
And with all that support, like with a program like yours, I'm sure if you did studies where if you took somebody who was just diagnosed and put through the traditional, go get your chemo, go home, go get your chemo, go home. And there's got to be some isolation with that. And that had put stress on the body and can affect and make that cancer worse, where now you go through your program where you're looking at the whole person and they're supported that they're going to have better outcomes.
Well, that's a great point because there are 5 pillars of integrative care for my online program. And the first one is calm and centered mindset. And I put that first because I think our emotional health determines everything.
Sure.
And our society doesn't really talk about how we need to take care of our emotional health. The message we get from our society is, you're depressed? Oh, here, take a pill. And the next thing you know, you're going to be serving your family dinner and a picnic outside. And usually these ads, which happen in the evening, are about women who are suffering from depression. Very few times is it men. So that gives us the subliminal messaging in our society of, there's nothing you can do to take care of yourself so you don't get that way. And I think that there is a lot that we can do. So community support and acknowledgement of the reality and getting educated and being empowered goes a long way, so you don't feel so much like a victim of, one, that I have breast cancer, and two, now I'm doing chemotherapy and I hate this and I don't want to be here. That's not the messaging that we want to give our body. We want to go in emotionally prepared, with envisioning the cancer cells taking up more of the chemotherapy and the healthy cells being protected. And one of the ways that we do that is through something called intermittent fasting or calorie restriction. And there is a huge body of research on this. And intermittent fasting has been used for hundreds of years through religious organizations use this, parts of the, they have fasting. And then when you think about what it was like for the caveman, I know we're going back thousands of years or millions of years. I mean, food wasn't always readily available. So what intermittent fasting does is it stresses out cancer cells. And
Wow.
Cancer cells don't like to be stressed. Cancer
Sure.
cells have this ability through something called the Warburg effect, which was scientifically proven by this scientist in the late 20s, and he won the Nobel Peace Prize for medicine for this in 1931, Otto Warburg. And what he discovered is that cancer cells, given a choice between having oxygen for energy or glucose, which is sugar, they would choose glucose, the path of glucose, even though that path gave the cancer cells less ATP or less energy. And so that is a very interesting component of what creates cancer or what drives cancer. That is the beginning of us having tools to really impact cancer growth. It's a very important concept there. So we want a diet or our nutrition to be very low glycemic, very low sugar, no matter what diet you want to put yourself on or your doctor tells you. There are lots of the ketogenic, the keto, the paleo. I recommend a modified Mediterranean diet, but whatever it is, it needs to be very low glycemic. And that includes not just sugar products, but also simple carbohydrates, complex carbohydrates, because they're quickly made into sugar. So intermittent fasting, what happens is when you reduce your calories or you fast for 2 days before and a day and a half after, you are stressing out your cancer cells because you're taking away their energy. So that chemotherapy comes in and the cancer cells go, oh, I'm hungry. I'm going to take this all up. And so what happens, which is very exciting, is the cancer cells take up more of the chemotherapy and the healthy cells are protected.
Oh,
And that
amazing.
it's a really wonderful benefit. And this is part of the empowered process that I want to provide for women throughout the world about. You can go into chemotherapy. Yes, it is not your first choice, but yes, it will help address your tumor burden. And let's go in prepared, like we're climbing a mountain or running a marathon or doing a triathlon, emotionally, using our guided imagery, physically with this intermittent fasting. We're going to bring our teas with us. We're going to do some herbs to reduce the side effects and prevent mouth sores. So it's like, okay, I'm going to do this. I'm taking it on. And maybe you'll do a cold cap so your hair doesn't fall out as much. So there's a lot. It doesn't have to be this horrible, treacherous experience.
And so what about families, because cancers and especially breast cancer is so prevalent? What about women who have this in their family history? What kind of things can they be thinking about or doing?
It's a wonderful question. If you have a first or second generation woman in your family who has had breast cancer, that does increase your risk for getting cancer. And also it's not just breast cancer, it could be colon cancer. There's some translation between colon and breast. Lung cancer, not so much, especially if somebody was a smoker, it doesn't really count. But I think understanding your family lineage as far as medical history is really important. So let's say your mother's sister, that's your aunt, had breast cancer. I think that puts you at higher risk. And so what I would do is first I would go see a genetic counselor. You can ask your gynecologist for a referral. And then you can also make sure that you're checking your breasts every month, because often breast little lumps are found from a woman doing self-breast exams. And learn how to do a self-breast exam. Just don't think, oh, I know how to do this. Either go online and find a place that on YouTube that shows you, or talk to your doctor about it, but really learn how to do an accurate breast assessment and do it monthly at the same time, and not right before you're going to get your period. So it should be at either the beginning or the second half of your cycle, because those hormonal fluctuations can make a difference. And then you might want to consider getting breast genetic screening. So do you have the BRCA1 and 2? Well, you won't know. Maybe you will know if your cousin or your aunt had that. But if you want to know if you have the BRCA1 or 2 genetic genomic SNP, that does increase your risk also for getting breast cancer. And then you can be put on a more advanced diagnostic mammograms or alternating mammograms and ultrasound and MRI. And then I would really look at the toxic environmental exposure you have in your life, as far as cleaning up your home with chemical products. I'd like to just tell a little story, which is really nice. This 30-something-year-old woman came to see me with failed IVFs and multiple miscarriages. And she looked pretty healthy. She was a little overweight, but, she looked beautiful. And I thought, so what's going on here? Why is this happening for her? And she had a lot of perfume on. And my office is scent free. So I used my intuition and I said to her, so tell me, you're wearing a lot of perfume. What's with you in scents? And she goes, oh, I love scents. She said, I have that, and I'm not going to mention the names, but I have the stuff that you plug into the wall in every room. And then I spray the stuff on the sofa that's advertised. You're supposed to do that a couple times a week. And I have candles going all over. So I'm thinking, this is why she's not able to, right. So I said to her, do me a favor, go home, and I want you to gather every single thing that you're talking about and put it on the table and take a picture for me. All the scent stuff, all the chemicals, all your laundry detergent, all your perfumes. I want everything in one place, and I want a photo. 29 items.
Oh my goodness.
Were in that photo. Hundreds of dollars, 29 items. And I said to her, this is why you can't get pregnant. And she had to throw out her sofa because she had sprayed it with that stuff so many times. She just had to buy a new sofa. I said that, and you sit on the sofa and all those chemicals, let's explain what happens to people. When you are exposing yourself to these plug-in things, the chemicals get into your nose, which goes right to your brain, which impacts your pituitary, and it affects your hormonal balance. You're in bed or you get out of a shower, and she was using dryer sheets, and your skin has been exposed and opened up from the hot shower, and you're drying yourself with a towel. So the chemicals from the dryer sheets were getting into your skin. You're sitting on the sofa with your dogs, you're petting the dogs, all those chemicals are getting into your body. And what happens with those chemicals, they're called estrogen disruptors. And people hear that word a lot, but I don't think they have an image of what it means. So I love this image. When estrogen is broken down in the body, it has to be eliminated through your urine and your feces. So it's floating around in your body waiting to bind to something so it can get eliminated. But these estrogen disruptors, let's say, for example, that these places where they're going to bind are like parking spots. These estrogen disruptors get into your body and they see these parking spots, and the parking spots say, you look close enough like estrogen, you can come park in here. So they've taken up the binding spots of the healthy estrogen, and the healthy estrogen goes to park its car to be bind out, and there's no place for it to go. So it stops being a healthy estrogen and starts becoming a non-healthy estrogen. And that's how you get estrogen dominance, because there's no place for it to go. And so that is the beginning of estrogen dominance. It can create PCO, polycystic ovarian syndrome. It can create painful menstrues or irregular menstrues. It can create fertility problems, and it can partially contribute to breast cancer.
This is amazing. I feel like I had a little light bulb just go up over my head, because I never thought of this before until you brought this up. And I'm thinking back of patients that I've had. And I was just talking to somebody earlier about how we've seen the number of polycystic ovarian syndrome go up. Like, it was something when I first came in practice, I didn't see that many patients with it. Now I see multiple patients daily.
Very common. Very common. And there's, people, I do a lot of PCOS in my practice, and people think of women with PCOS as being overweight and they have, acne maybe and a pear-shaped, but there are women who are thin and they have PCOS. And polycystic ovarian syndrome, let's just talk about that. The basis of it is hormonal imbalance and estrogen imbalance. And your body is so out of balance that it's making like hundreds of little cysts in your ovaries. And you often have estrogen dominance and too much testosterone, and your progesterone's out of balance. And the foundational approach of this, ladies, is that we must remove all these offending toxins and clean you out with, nurturing nutrition, and help your body detoxify from the estrogen that is floating around and not able to get out of your body. And one of the main contributing factors that I've seen, because I have women, they've cleaned up their nutrition, their house is now toxin-free, they use eco products, but they're still irregular, and it's nails. Notice I don't have any polish on my hands. For some reason in our society, it's a big thing for women to go have these fake nails put on with that. They come out here and they're colored, and the glue and the toxins that you're putting on your nails is it's very damaging. So we all have to make a choice between having nice normal nails or these flashy nails and having polycystic ovarian syndrome or hormonal imbalance. I always opt for health, but then again, I'm old. But I understand these young girls have said to me, this is a cool thing. How am I going to be without my nails? I said, make a choice. You can, get rid of these fake nails, get healthy nails. It takes a while for your nails to get healthy, and then use eco nail polish and just have normal nail polish without these fake things with the little dot. It's just, and it's hundreds of dollars to do that stuff. So become empowered and take back your health and stop doing fake nails.
And it was something was brought up on the website that we're part of earlier today. I don't know if you had a chance to see it. Somebody posted something about hair dyes leading to
yes.
cancers.
Yeah, I saw that. Yeah, I saw that. I haven't had a chance to read the actual article because I've gotten a lot of concerns. I don't think there's one thing. Well, the thing that was alarming is they found that it impacted, first of all, hair, not just hair dyes, but hair straighteners are a very different chemical composition than hair dyes.
Yes.
And so let's just separate that. It's like talking about potatoes and peaches. One thing has nothing to do with the other. So they found that hair straighteners for African American women really increased their breast cancer. Now, I have to look at the actual study. One of the things that I have problems with, because I do spend a lot of my time in PubMed reading breast cancer research.
Sure.
There are so many contributing factors to breast cancer. So when I read an article or study that says, well, this one thing made a difference or this one thing increased your risk, I don't think it's necessarily valid. And also, the title breast cancer is a chapter heading. And even the ER, PR, the hormonal status, that's a subheading. But then when you get into the genomics and the genetics of people's markers, everyone who has breast cancer is different.
Yes.
And that needs to be treated differently. So there's something called a Ki-67, which is a stain, which shows how many cells out of 100 cells are in the S phase of mitosis or division. And that is what happens when a cell becomes active and it's growing. So if you have a higher Ki-67, it means that your breast cancer is more aggressive or spreading more, growing more, not spreading, growing more. So two women could have ER/PR positive and HER2 negative or HER2 positive, it doesn't matter. But one woman's Ki-67 could be a higher number and one woman's Ki-67 could be a lower number. And therefore, they're in different categories.
That makes a lot of sense. And it's tough. And, reading studies sometimes, we just don't know things. I mean, it's design study is another whole topic, which sometimes makes it difficult that, we're not all living in a bubble. So trying to say that one factor is the one and only cause of something makes it difficult to make that comment or to truly study the activity of these cells and these cancers. So, I think we're learning more and more every day. And I'm very excited about the holistic approach to these conditions too. And for the longest time, I think traditional medicine has separated the mind component, the spiritual mind component from disease states. And now we know that really, like you said before, going in prepared and going in the right mindset really does affect your outcomes in the long term.
Well, I love that you brought up the spiritual component because I wrote a blog and it's part of my online program, Breast Cancer as a Spiritual Path. And that was a controversial blog. Some women were offended by that. And they said, I live healthy, I eat healthy, and I still have breast cancer. So what the heck's going on here? And, my friend who had breast cancer ate organic, lived healthy, and didn't have any familial genetic components. And she ended up with breast cancer. Now, Ashkenazi Jews have a higher risk of breast cancer than other genetic components, but it happens. And I think that we can't choose what disease we get, but staying rooted in anger is not how anybody gets healthy in any way ever. And it's unfortunate if you're diagnosed with this disease or any other serious disease or any type of cancer. But okay, now that you're here, how can we make this really a transformative experience in all levels for you so that you come through it no matter what happens? You come through it knowing, one, that you made the choices that you made, that you chose to have a mastectomy or not, that you did choose to undergo chemotherapy or yes to radiation or no to radiation, that you got support and you were the mistress of your path. And breast cancer is a very intense journey. It's not an easy thing to have your breasts removed.
Sure.
And also sometimes then women choose implants, and that's a whole nother topic, but they, get sick from the implants, or the reconstruction doesn't go as well, or they don't heal. And so there's a lot of misnomers about how to best proceed. And I had a woman post in my Facebook group. First of all, she was obese. And then she had radiation, and the doctors first of all, I don't think somebody who is obese should have implants.
Sure. They're not going to heal as well.
Right. And then she had massive amounts of radiation to her chest and with her implants in there, and she had horrible 3rd-degree burns on her skin. And she was in England. And the whole thing for me was extremely upsetting that, one, her doctor didn't realize that when somebody is so obese that they have inflammation, and she should not have been offered implants, or not at that time. And that you don't necessarily do radiation over implants.
Yes.
So, I mean, that was, the whole picture of the person needs to be considered.
It's interesting when you're talking earlier about breast exams. And in my traditional training, we were always taught to do breast exams on patients and explain to patients to do self breast exams. and I can't remember exactly, but it was a couple years ago, the U.S. Health Task Force stopped recommending
Uh-oh.
physician breast exams and self breast exams. And I'm like, this is absolute insanity. And the reason being is because the US, the Health Task Force, they look at cost benefits. And so they said that false positives of finding things on palpation created more testing and more surgeries that were unnecessary. And so they took that and translated it into, well, everybody just stopped doing breast exams. And I'm like, has everyone lost their minds? I couldn't believe that this was a recommendation that was being put out by our government and then being taken up by our major health organizations like the American College of OBGYN. And it's just absolutely amazing.
It's alarming, and I don't understand that philosophy. I think, women need to do self-breast exams. And yeah.
I tell patients all the time, your breasts are with you every single day, and you're more likely to find something than going to the gynecologist or at whatever doctor does the breast exam with them checking like once a year.
Mm-hmm.
Because we're not all familiar with the patient's lumps and bumps.
Right.
I always encourage people become familiar with your normal lumps and bumps, because the breast tissue is lumpy and bumpy, and it changes as we get older. We lose some of those bumps, we lose some of the fat, and some of the breast tissue gets replaced with fat. But you're more likely to find something if you're more familiar with your own body. Luckily, my mom was in this situation where she was 49. She found a lump, and it didn't show up on mammogram.
Oh.
And she insisted on having it out. And she went to doctor after doctor, and they were like, no, there's nothing there. We don't find anything. It's just a cyst. Leave it alone. And she was like, no, there's something there. I want it out. Well, they actually even had a hard time doing the surgery because they had such a hard time finding it.
Mm-hmm.
And they ended up finding it, and it was a lobular breast cancer.
Oh.
So luckily, she's now 70 something, and she's doing great. But this is why I always tell people, become familiar with your body and your intuition, and whatever things are telling you, be your own advocate.
That's extremely important, especially with the story as you just shared. It's extremely important. I mean, if you feel something and one doctor says, no, you're wrong, and you know in your heart and your being that you're right, you have to find another doctor. I mean, this is an important empowerment moment for women. Your oncologist needs to listen to you. And I have women come in to see me, and they said, my oncologist says no vitamins. And I go, oh, really? Okay. So, I just send the oncologist an email, and I said, here's 50 studies in PubMed about, and also the other thing that I think is important is there are certain supplements that you don't want to interfere with chemotherapy. I think it's important to be respectful of chemotherapy and radiation. So if you're working with a seasoned practitioner such as myself or an educated practitioner, we understand that, and you don't want to interfere with chemotherapy. So you have the person stop taking certain supplements 3 or 4 days before chemotherapy and 3 days afterwards. And that way, because of the half-life of the supplements and the chemotherapy, there's no risk of interference. And I don't want any interference with chemotherapy. I want to get in there and kill those cancer cells and protect your healthy cells. And let's take care of your gut and take care of your mind and keep you nutritionally optimized and get through this.
It's tough. I guess with the supplements, it gets also very confusing too about what things to be on. But I did see that you had a blog on your website about vitamin D and vitamin D deficiencies and its connection with cancers.
Right. Well, the reason I chose vitamin D is because there is a ton of research about vitamin D. And I want to start off by saying there's no one supplement people need to be on. It's a comprehensive protocol, but let's talk about vitamin D. There is a ton of research, and everybody agrees that vitamin D deficiency contributes to immune deficiency and disease, number one. Number two, as we have become more computer savvy, the majority of us are no longer outside, and we're sitting inside working even in the summer. And vitamin D, the sun gets into our skin, and then it's translated, created through a couple different biochemical processes from our skin into our liver and excreted through the kidneys and the intestines. So we need vitamin D. It's a very big contributing component of our healthy immune system. And the majority of Americans are vitamin D deficient. So in my clinical practice, I recommend everyone take a 5,000 IU vitamin D, and we'll talk about supplements in a second. But I've had people come into me and their doctors have put them on 50,000 IU once a week or something. And I go, first of all, vitamin D is a fat-soluble vitamin. So you can't take that much at once. And second of all, there's no way anybody would ever get 50,000 IU of vitamin D in their skin in a day or a week. That just doesn't happen. So you don't want to be in a glass store and hit everything over the head with a hammer. You need to be respectful of the components of the body and how we process things. And taking a little capsule or some drops of 5,000 IU vitamin D is usually enough. Sometimes I would give 10,000 for a couple of weeks and then go back down to 5. But no matter what else anyone is doing to take care of their health across the board, especially in the winter with the flu season happening, taking 5 or 10,000 IU vitamin D every day is a simple thing to do to take care of your health.
I think that's a very important message. And then it gets confusing because of not only we're inside all the time, but then when we do go outside, we're putting sunscreen on. So
let's talk about that. Yes. Please do not use that orange colored sunscreen that you buy from the normal drugstore. In our community, we have Third Rock Essentials, and their products are so pure that you can eat them and not get sick. And they make a fantastic sunscreen, people. So thirdrock.com, and I give this sunscreen. It's great I put it in people's stockings. I give it out in my office for the holidays, and they say to me, "Why are you giving us sunscreen in December?" I go, "Well, I'm giving it to you in December, so you'll have it in June, July, and August." So yes, we need to have sunscreen, but not the toxic stuff that is filled with chemicals and estrogen disruptors.
Yes. So, is there any other points that you want to make about hormones and cancers that we don't know?
You don't know. I don't know.
I don't know.
One thing I want to say is that all supplements are not created equally.
Yes.
So I have people when people come in to see me, I ask them to bring their products that they're using in a bag, and they come in with products from Trader Joe's, Costco, Sam's, and CVS. And even sometimes Whole Foods. You're wasting your money. Somebody came in with, don't want to mention the name. Somebody came in with a product that was just so filled with chemicals that was useless. I had them throw it out. So if you're going to buy supplements, try to look for products that are made to pharmaceutical quality standards. That's really important. The companies that I've spent my time researching that I can absolutely say they have extreme quality control, and I'm going to list them because you can find them on the internet. Zymogen is one, Metagenics, Integrative Therapeutics, Designs for Health, Apex and Biotics, Nutribiogenesis, and the company that my mentor, Donnie Yance, has is called Natura Herbal Formulations. All of those products, those companies are easily found on the internet. And anything you buy from them, vitamin D or whatever, you know that you're going to be getting the actual product without fillers made to pharmaceutical quality standards. So I encourage everyone to be really proactive and put your money in a way that's going to take care of your health and not just, I'm taking vitamin D. How come my vitamin D level isn't going up? Well, it's because you're taking vitamin D from Trader Joe's, and who knows really what's in here.
And that's a good point, because a lot of the times the fillers are what's causing, inflammation in people's bodies. So here they're trying to take these supplements to become healthier, and now the fillers are causing inflammation, which is adding to their disease states. So it becomes very difficult.
Right. The other thing I want to say about your hormones is your hormones are not separate from your health. Your hormones reflect how you take care of yourself every day, and they reflect your healthy lifestyle. Do you have a toxin-free home? What kind of dishes, pots and pans are you cooking on? What's your plastic exposure in your kitchen? We don't have any plastic in my kitchen. It's all glass. Is your water filtered? Are you drinking water out of plastic bottles that, have sat in the sun, and then the BPAs and the BSAs in the plastic have gotten into the water, and then you're drinking it? I mean, your hormonal levels are not separate from who you are. Yes. And we want to be healthy. All people want to be healthy. And a few little lifestyle changes can make a really big difference.
Those are great points. Thank you so much for sharing that.
My pleasure.
And where can people find out more information about you?
Well, my practice website is my name, CarolLourie.com, and there is a contact me page. And my online healing program, the pathofbreastcancer.com, is thepathofbreastcancer.com. And
all great options. Thank you so much.
My pleasure.
And thank you very much for being with me today.
Oh,
information was amazing.
Thank you so much for having me, really.
Do you suffer from vaginal dryness? Get recurrent urinary tract infections? How about recurrent vaginal infections? Didn't get the menopause memo? Well, guess what? Now there's the Happy Vagina Rally, the pelvic health summit for perimenopausal and menopausal women, where you can get all the answers you need about pelvic health and menopause. The Happy Vagina Rally will be held November 13th through 15th, 2020, virtually. For more information, go to drbetsygreenleaf.com, and we're looking forward to seeing you there. Get the answers that'll make you smile.
Feel the people.